Hi, this is Dr. Michael Persky. I'm a facial plastic surgeon here in Encino, California. We like to think of Encino as the Beverly Hills of the San Fernando Valley. I am a consultant and lecturer as well as an instructor for Valiant, which is the company that makes Sculptra. And today I'd like to talk to you about one of the questions the patient asked me today during consultation, which is what makes Sculptra different from other fillers? Sculptra is a biostimulatory filler, which means that when we inject it, it stimulates the immune system to make volume and increase the volume of the face. All other fillers fill the hollows of the face, fill the lines of the face. A few years back, thanks to the work of Val Lambros and Rod Rohrich, Joel Pessa, Rebecca Fitzgerald, Danny Vlagar, a consensus about facial aging was come to, and that is that rather than filling the lines of the face when they occur, those lines are occurring because of loss of volume in the face from the loss of fat in the preauricular area, the temple area, over the brows, the cheeks, the chin. And that's what's causing the lines rather than just filling lines. What we're now doing, our philosophy again has changed. We are now filling the areas up where we've lost the volume, and by reinflating the face, it actually takes care of those lines without having to fill them. Of course, even with Sculptra, there may be a few superficial lines that will be filled with other fillers, and it's nice to combine other fillers with Sculptra. It's not all of one or all of the other. But what's nice about Sculptra is it lets us globally fill the face in a way that is really not possible with other fillers. Even with fat, when we take patients to the operating room and do fat transfers, we're able to again fill the face, but Sculptra is a lot more predictable and reliable than fat. When we put fat transfers in, approximately 40 to 60% of the fat survives, and we don't know how much of it will survive and where it will survive. So as Dr. Lambros says, the most common procedure that fat surgeons do is fat transfer, and the second most common is a second fat transfer, and then the third one is, because the fat that stays is permanent, is removing the fat. So with Sculptra, we are able to predictably rejuvenate the face by replacing lost volume. That's really the main difference between Sculptra and other fillers. The other difference is, with other fillers, the injection process is done, the face is filled, and the patient walks out, and there's a finite amount of time, 6 to 12 months, before the patient needs to come back to have more filler put in. With Sculptra, the amount of volume change is directly related to how many sessions the patient has. So in other words, the first time a patient has Sculptra, we may inject them, and we don't inject them to fill all the hollows. You have to think of it more in terms of spreading seeds out to grow new collagen in the places where we want to grow it. And we can't, and we don't, fill those areas up to max. It would be like putting fertilizer on a lawn up to here and expecting to grow more grass. There's only so much collagen that will grow at one time with a treatment session of Sculptra. So after the session, the patient will wait a good 6 to 8 weeks, come back, and then we can treat again in the areas where more volume is needed. The amount of volume replacement with Sculptra is directly related to how many injection sessions the patient has or needs. Younger patients may need 1 or 2, older patients may need 3 to 4 sessions, and much older patients who have a lot of volume loss would probably be better served by having a facelift and maybe fat injected at the same time. Economically, Sculptra makes sense over other fillers in that once the patient reaches full correction and the face is rejuvenated, we don't have to treat patients again for 2 to 4 years. So when you amortize the cost of Sculptra over time, it's a lot less expensive than the other fillers that you need to start over again every time they run out. And again, the nice thing about Sculptra at that 2 to 4 year point where you put a little bit more in. You don't have to start all over by building things up because the patient has a nice base of their own collagen. I hope that answers most of your questions about Sculptra. Certainly if you have any more, please feel free to contact me either at my website, you can call my office, or email me. I'll be happy to get back with you. Be well. Bye-bye.